welcome to another deep dive. We're always trying to bring you the most fascinating topics.
Absolutely.
And today I think we have one that's going to resonate with pretty much everyone. I mean, who doesn't have some sort of memory of their teenage years.
Yeah. Good or bad?
Good or bad.
Yeah.
The ups and downs of adolescence. It's such a pivotal time.
It really is. It's a really transformative time. And I think it's really interesting to sort of unpack that a little bit and look at some of the forces that contribute to this becoming, the adults that we are today.
Right. And that's exactly what we're going to do today, right?
Yeah, that's it.
We're tackling adolescence head on.
Uh-huh. Yeah.
And specifically, all the psychosocial development that happens during this time, right? The changes, the challenges. And we're going to explore all of that. And not just for, teenagers themselves, but I think this is relevant for parents, educators, and really anyone who wants to understand this stage of life a little bit better.
Yeah.
So to do that, we've drawn on a whole bunch of different sources.
Yeah.
Developmental psychology, sociology, neuroscience.
Oh, that's everything, really. Yeah.
Yeah. We're going deep into all of this. We're going to be looking at how teenagers form their identities.
Right.
That search for who am I?
Yeah. Such a core part of adolescence.
It's huge.
Yeah.
Family dynamics, how those change. And of course, we can't talk about adolescence without talking about, the world of friends and romance. And they're also, it's not all sunshine and roses, right?
No.
There's some serious challenges that can come up during these years. Things like substance use, depression, anxiety. We're going to get into all of that as well.
Absolutely. Yeah.
And so the goal here really is to distill those key insights, to understand the forces at play and how all of this shapes who we become.
Yeah.
Without, getting too bogged down in all the nitty-gritty. So with that said, let's just jump right in.
Let's do it.
And I guess the logical place to start is with this concept of identity. Right?
Yeah.
We hear that word a lot, especially when we talk about teenagers, but what are we really talking about when we talk about identity in adolescence?
Well, I think you're right. It's a word we hear a lot, but it's worth sort of unpacking a little bit, right?
Yeah.
So in this context, when we're talking about adolescent identity, it's really about a stable and coherent sense of self.
Okay.
Right? It's about those labels that you were mentioning earlier, student, athlete, artist, but it's also those values, beliefs, what you envision for your future, really. And I guess that answer to the question, who am I, that really starts to come into play.
And, this makes me think of Erikson. Right?
Of course, yeah.
His famous theory of psychosocial development.
Yeah.
And particularly that stage of identity versus role confusion.
Right. Yeah. It's the fifth stage in his theory.
Yeah.
And he really argued that this was the defining challenge of adolescence. This whole idea that teenagers are grappling with this question of, who am I? They're trying on different hats. They're experimenting with different roles, different personas. And if they're not successful, so to speak, in sort of resolving this crisis, it can lead to what he called role confusion.
Yeah. So let's unpack that a little bit. So identity achievement, that's sort of the desired outcome here, right?
Right.
What does it look like when a teenager reaches that point of identity achievement?
Well, I guess identity achievement would mean that they have, gone through that period of exploration and come to a point where they have a relatively clear understanding of themselves. And it's not just a surface level understanding. It's rooted in their past experiences. It aligns with their future aspirations. They feel comfortable in their own skin.
They feel like they know who they are.
Exactly.
And where they're going. Okay, so that's identity achievement. But, you mentioned role confusion. I mean, this is kind of classic teenage angst, right?
Right.
But it sounds like it's more than that.
Yeah, it's more than just feeling a little lost,
Yeah.
It's a deeper lack of a sense of self. And what's sort of more telling, I think, is that they may not be that concerned about figuring it out.
Really?
Yeah, there's a lack of active exploration. There's no strong commitments to any particular identity.
So it's not that they're actively searching, they're just kind of drifting.
Yeah. And that can be problematic, obviously.
Yeah, okay. And then we have these other terms, right?
Yeah.
Foreclosure and moratorium.
Yeah.
And foreclosure almost sounds like a negative term, right?
Yeah.
Like you're closing off possibilities.
Yeah, and in a way, that's kind of what it is, foreclosure. is when someone adopts the roles, values, beliefs of their parents or society without really questioning them.
So they haven't done the work.
Right.
They haven't done the exploration.
Exactly. It's sort of an inherited identity rather than a constructed one.
Okay, give me an example.
Sure. So, for example, you could imagine someone who decides to become a doctor just because their parents are doctors, and it's always been expected of them. They haven't really explored other options. They haven't thought about their own passions. They're just following a predetermined path.
Right, right. So it's not necessarily a bad thing, but it's not necessarily authentic either.
Exactly.
Okay, so that's foreclosure. And then moratorium, that sounds a little bit more positive, right? Like a timeout, chance to explore.
Yeah, exactly. Moratorium is like a timeout, a pause. You're actively exploring your options, you're trying different things, but you haven't made any firm commitments yet.
Okay.
And a classic example of this is going to college. You know, you're exposed to all these different fields of study. You're meeting people from different backgrounds. It's a time for exploration and self-discovery.
Yeah. Okay, and now there's another guy, right?
Mm-hmm.
James Marcia.
Yes.
Who kind of built on Erikson's work. And he came up with these 4 identity statuses.
Yeah.
How do those relate to Erikson's stages?
So I think what Marcia did really well was to make Erikson's ideas more concrete.
Okay.
So he took these 2 key dimensions, exploration, you know, have you actually thought about different options?
Right.
And commitment, you know, have you made a choice and are you invested in it?
Yeah.
And he basically created a matrix. So you have low exploration, low commitment, that's role confusion. You're not looking, you're not deciding.
Got it.
Low exploration, high commitment, that's foreclosure. You've made a choice, but it's based on external influences, not your own exploration.
Mm-hmm.
High exploration, low commitment, that's moratorium. You're searching, but you haven't settled yet. And then high exploration, high commitment, that's identity achievement. You've explored and you've made your own choice.
Right. So he's basically giving us a framework for understanding how people move through these different stages.
Exactly.
Okay. And, you know, this whole idea of identity, it's not just one big thing, right? It's broken down into these different domains.
Right.
We have religious identity, political identity, ethnic identity, gender identity.
Yeah.
Let's talk about religious identity first. What does that look like in adolescence?
So typically, adolescents initially tend to just adopt whatever religious beliefs their families have.
Right, makes sense.
But as they get older, they start to question things. They might explore different interpretations of their own faith. They might look at other religions. It's a time where they're trying to figure out what they believe personally.
Right, so it's not just blind acceptance anymore. Okay. And then we have political identity. I mean, teenagers today, they seem to be a lot more politically aware, politically active.
Yeah, I think that's fair to say. And actually, a lot of teenagers today identify as independent. They don't align with a specific party.
Really?
Yeah. And they also tend to be more liberal than their parents.
Okay.
But those major shifts in party affiliation, those usually happen later in adulthood.
Interesting.
And another thing to keep in mind is that for many adolescents, their political views are really intertwined with their ethnic identity.
Right, right. So let's talk about ethnic identity then, especially in countries like the U.S. and Canada, where we have such a diverse population.
Yeah.
How does ethnic identity develop in adolescence from these diverse backgrounds?
Well, I think it's important to acknowledge that a huge percentage of adolescents in the U.S. and Canada today are from diverse ethnic backgrounds.
Yeah.
And so their ethnic identity becomes a really important part of their overall sense of self.
Right.
And for some, it can be more complex than for others. You know, if you're multiracial, if you're an immigrant, if you're adopted into a family of a different ethnicity, you're navigating different challenges.
Right.
And there's a lot of research showing that having a strong sense of ethnic pride is actually correlated with well-being and academic success.
Okay.
But it's important to remember that this is a complex experience.
Of course.
And there's a lot of variation.
It's not just one size fits all.
Yeah.
Okay, and then we have gender identity, which I think has become a much more, nuanced topic in recent years.
Absolutely. I mean, Erikson had this idea of gender intensification, where adolescents kind of double down on traditional gender roles.
Uh-huh.
But that doesn't really capture the complexity of gender identity today.
Right.
We now talk about gender identity as an internal sense of being male, female, transgender, non-binary, or another gender.
And so how does this develop?
Well, it often starts with the sex you're assigned at birth.
Yeah.
And then society kind of tells you what it means to be male or female. But many adolescents question those roles. They redefine them.
They push back.
They do. And we even see the concepts of foreclosure and moratorium in relation to gender identity.
Really?
Yeah. So you can imagine someone experiencing foreclosure by rigidly adhering to very traditional masculine or feminine roles,
right,
without exploring their own internal sense of self.
Got it.
And then someone in moratorium might avoid romantic relationships altogether as they figure out their gender identity.
Okay, and I think it's important to define some key terms here, right?
Yes.
Because we're throwing around words like gender binary, transgender, cisgender, LGBTQIA+.
Right.
Let's make sure everyone's on the same page.
Okay. So gender binary, that's the idea that there are only two genders, male and female.
Okay.
And everyone fits neatly into one of those categories.
Right.
But we know that's not true.
Right.
So a transgender person is someone whose gender identity is different from the sex they were assigned at birth. Cisgender means your gender identity aligns with the sex you were assigned at birth.
Alrighty.
And LGBTQIA+ is an umbrella term for a wide range of gender identities and sexual orientations.
Okay.
Lesbian, gay, bisexual, transgender, queer, questioning, intersex, asexual, and many others.
It's about acknowledging the diversity of human experience.
Exactly.
Okay, so we talked about identity, this huge, developmental task of adolescence.
Right.
But let's shift gears a little bit and talk about relationships, because obviously relationships change a lot during this time.
They do.
And let's start with family.
Right.
We all know those teenage years can be a time of, shall we say, heightened emotions.
Yes.
And conflict. Is conflict just an inevitable part of having a teenager in the house?
Well, I think it's fair to say that conflict is a natural part of all close relationships.
Right.
And that includes families with adolescents.
Right.
But the key for parents is to find that balance between support and autonomy. You want to be there for your kids, but you also want to give them the space to grow and become independent.
Yeah, you don't want to stifle them. Okay, and the sources talk about this idea of family closeness as being a really important protective factor. What does that actually mean?
So family closeness encompasses things like open communication,
Okay.
support, connectedness, and also a certain level of parental monitoring.
Okay, so parents still need to be involved.
Yes, absolutely. It's not about being completely hands-off. It's about knowing what your kids are up to, who their friends are, where they're going.
Right, being aware.
Exactly.
Okay, and it's fascinating how cultural norms can play a role in all of this, right?
Well,
the sources mentioned familism.
Yes.
How does that influence family dynamics during adolescence?
So familism is this idea of prioritizing the family unit above individual needs.
Okay.
And in cultures that emphasize familism, we often see less parent-child conflict. Yeah, because teenagers are less likely to challenge their parents or do things that would bring shame to the family.
So it's about maintaining that family harmony.
Exactly.
Interesting. And then we have the other side of the coin, right?
Yeah.
Peer relationships.
Huge during adolescence.
Huge. And we all hear about peer pressure, right?
Right.
But what's actually happening there? How does it work?
So peer pressure is really just social influence.
Okay.
It's your friends encouraging you to do things, to dress a certain way, to think a certain way.
Right.
And it's so powerful during adolescence because fitting in is so important.
Yeah, you want to be accepted.
Exactly.
Okay, and there are different ways that this influence can happen, right?
Right.
The sources talk about selection and facilitation.
Yeah. So selection is the idea that teenagers choose friends who are already similar to them.
Okay.
So you're drawn to people who share your values, your interests.
Right.
And facilitation is when your friends actually encourage certain behaviors. So it could be positive, like encouraging each other to study, or it could be negative, like encouraging each other to take risks.
Right. So peers can have both a good and bad influence.
Absolutely.
Okay. And then there's this term deviancy training.
Yeah.
Which sounds pretty bad.
It is. Deviancy training is when peers actually teach each other how to engage in deviant behavior.
So they're reinforcing bad choices.
Yeah.
Okay. And amidst all this, amidst these changing family dynamics and peer influences, we have the emergence of romance.
Right.
First love.
Yeah.
All that good stuff. So how do romantic relationships typically develop?
Well, it usually starts with same-sex friend groups in childhood.
Okay.
And then as kids move into early adolescence, you start to see these mixed-sex groups forming.
Yeah.
But they're pretty loose associations at first.
Okay.
And then those groups get smaller and the bonds get closer.
Right.
And eventually you see couples forming
Okay.
with more private intimacy.
Yeah. And first love, I mean, that's such a formative experience.
It is.
What does the research say about that?
Well, most first loves happen in high school.
Okay.
And they don't usually last very long.
Right.
Less than a year on average.
Okay.
And interestingly, girls are more likely to report having a steady partner than boys.
Oh.
Yeah. And of course, breakups are really common.
Of course. Yeah.
And those can be really tough for adolescents to deal with.
Absolutely. Heartbreak is real at any age.
It is.
And same-sex romances, we're seeing a lot more visibility and acceptance of those relationships.
We are.
How are those developing during adolescence?
Well, I think culture plays a huge role here.
Yeah.
In North America and Western Europe, there's much more awareness and acceptance of diverse gender identities and sexual orientations than there was in the past.
Right.
And so that creates a different context for same-sex romances to develop.
Right.
But it's important to note that the research findings in this area can vary a lot depending on the culture, the specific group being studied.
Of course.
Yeah, so it's not a simple picture.
Right. And speaking of orientation, let's define sexual orientation really quickly.
Okay.
Because it could be a fluid thing, especially during the teenage years.
It can. So sexual orientation refers to your enduring pattern of romantic, emotional, or sexual attraction.
Okay.
To men, women, or both.
Got it.
And for some people, their sexual orientation might be very stable from a young age.
Yeah.
But for others, it might be more fluid. It might evolve over time.
So it's a journey.
It is.
Okay. Now, as adolescents are going through all of this, these issues of identity, relationships, there are all sorts of challenges that can come up.
Right.
And one area that I think is really important to talk about is sex education.
Absolutely.
Where are teenagers getting their information about sex?
From all sorts of places.
Right.
I mean, the media is a big one. And studies have shown that the more exposure teenagers have to sexual content in the media, the earlier they tend to initiate sexual activity.
Okay.
So that's definitely something to be aware of.
What about parents?
Parents are obviously a key source of information.
Yeah.
But the problem is that a lot of parents don't feel comfortable talking to their kids about sex.
Really?
Yeah, they might avoid the topic. They might not give accurate information.
So what's the solution?
Well, the research is very clear on this.
Okay.
Open, honest communication between parents and children about sex and relationships is the best way to promote healthy attitudes and behaviors.
Okay, so it's not about being preachy or judgmental.
No, it's about having those conversations in a way that's supportive and informative.
Right.
And starting early.
Okay. And then we have peers, right?
Yeah.
Teenagers talk to each other.
They do. And peer influence is huge when it comes to sexual behavior.
Right.
Especially if parents aren't talking to their kids. So teenagers are getting information from their friends. They're learning about what's considered normal or acceptable within their peer group.
Right.
And the problem is that a lot of adolescents, even those who are sexually active, don't talk about things like contraception and STIs.
They don't.
No, they're not having those conversations.
Wow.
And so they might not be making informed decisions.
That's scary.
Yeah.
Okay, what about schools?
Well, most parents in the U.S. actually support comprehensive sex education in schools.
They do?
Yeah, they want their kids to be learning about this stuff.
Okay.
But the specific content and timing of these programs can vary a lot depending on where you live.
Right.
And it's worth noting that abstinence-only programs have not been shown to be effective.
Really?
No, they don't delay sexual activity, and they don't reduce rates of STIs or unintended pregnancies.
Okay, so that's not the answer.
No.
And of course, we can't talk about sex education without talking about technology.
Right.
How has technology changed the landscape of relationships and sex education?
In a lot of ways.
Yeah.
I mean, there are a lot of positives,
Yeah.
but there are also some serious concerns.
Like what?
Well, there's the issue of gender inequity in online interactions,
Okay.
the potential for online sexual abuse and exploitation.
Oh,
Cyberbullying is a huge problem.
of course.
And then there's this phenomenon of relationships stopping, where people use technology to end relationships.
Really?
Yeah, it's like breaking up with someone over text message,
Wow.
which can be really hurtful and impersonal.
Yeah, that's tough. Okay, so we've talked about sex education, but there Other challenges that come up during adolescence, right?
Right.
And I think sadness and anger are two big ones.
Yeah.
Depression is a really serious issue.
It is, and it's actually quite common during adolescence.
Okay.
Self-esteem often takes a dip around puberty for both boys and girls.
Uh-huh.
And a lot of teenagers report symptoms of depression.
So what are some of the signs?
Well, it can vary, but it might be changes in mood, changes in sleep patterns, loss of interest in activities they used to enjoy,
Okay.
withdrawal from friends and family.
Right.
And it's important to note that social support is really important here.
Yeah.
Teenagers who have strong relationships with their families and friends tend to be more resilient.
Right. They have a support system.
Exactly.
Okay. And then we have major depressive disorder.
Right.
Which is more than just feeling sad or down sometimes.
Right. Major depressive disorder is a serious clinical condition.
Okay.
It's characterized by persistent feelings of sadness, hopelessness, worthlessness,
Right.
loss of interest in activities, fatigue.
Yeah.
And there are a lot of factors that can contribute to it.
Like what?
Well, there are biological factors, genetic factors, psychological stress, negative thought patterns.
So it's complex?
It is. And tragically, for some adolescents, these feelings can lead to thoughts of suicide.
Yeah. And that's a really difficult topic to talk about, but it's so important.
It is.
So let's define some terms here.
Okay.
Cluster suicides. Parasuicide. Suicidal ideation.
Okay. So cluster suicides are when you have multiple suicides happening in close proximity.
So within a community or a school.
Right.
Okay.
And parasuicide is any intentional act of self-harm that could be lethal but doesn't result in death.
So it's like a suicide attempt that doesn't succeed.
Right.
Okay.
And suicidal ideation is simply having thoughts about suicide.
Okay.
Which can range from fleeting thoughts to more serious planning.
And how common are these thoughts?
Unfortunately, they're more common than we'd like to think.
Yeah.
Research suggests that about 24% of female high school students in the U.S. have seriously considered suicide.
Wow.
And about 13% of male students.
So it's a significant problem.
It is.
Okay. Now, let's switch gears again and talk about delinquency and defiance.
Okay.
Acting out, breaking rules.
Right.
This is something we often associate with adolescence.
Yeah, and it's interesting because during adolescence, we actually see externalizing behaviors like acting out and internalizing behaviors like depression, becoming more connected.
Really?
Yeah, they're not as separate as they are at other stages of development.
Interesting.
And most adolescents actually report engaging in some form of law-breaking behavior before the age of 20.
Wow.
But the accuracy of those self-reports can vary, of course.
Of course, yeah.
And it's important to acknowledge that certain groups are disproportionately represented in arrest statistics.
Right.
Boys, ethnic minorities, adolescents from lower socioeconomic backgrounds.
So there are systemic factors at play.
Absolutely.
Okay. And is it just hormones?
Well, increased anger is certainly a normal part of puberty.
Yeah.
But most adolescents learn to express their anger in healthy ways.
Okay.
It's helpful to distinguish between life course persistent offenders whose antisocial behavior starts early and continues into adulthood.
Right.
And adolescence limited offenders whose delinquency is confined to the teenage years.
Okay, so there are different trajectories.
Right.
And are there typical pathways that can lead to more serious delinquency?
There can be. You might see a progression from stubbornness to defiance, from shoplifting to more serious crimes,
Right.
from bullying to violence.
And interestingly, adolescent crime rates have actually been declining in recent years.
They have.
Why is that?
Well, there are a number of potential explanations.
Okay.
Lower high school dropout rates.
Okay.
Smaller family sizes.
Uh-huh.
Better access to contraception and abortion.
Okay.
Stricter drug laws.
Right.
And also a larger proportion of immigrant families who tend to have lower rates of delinquency.
Interesting. Okay, so we've covered a lot of ground here.
We have.
But there's one more challenge that I think we need to address.
Okay.
And that's drug use and abuse.
Right.
What are the patterns we see during adolescence?
Well, drug use tends to increase starting around age 10.
Okay.
It peaks in young adulthood around age 25,
Mm-hmm.
and then it usually starts to decline.
Oh, okay.
And one thing that's really important to note is that early initiation, using drugs before the age of 15, is a strong predictor of later substance use issues.
So the earlier you start, the more likely you are to have problems later on.
Exactly.
Okay.
And we also see these cohort differences, generational differences.
Right.
So, for example, in the U.S., overall drug use has actually decreased since the 1970s.
Really?
Yeah.
But we've seen an increase in vaping recently, right?
We have, yeah.
Okay.
And another really important point is that it's not just about availability.
Okay.
It's about perceived risk.
What does that mean?
So if teenagers perceive a drug as being risky, they're less likely to use it, even if it's readily available.
So it's about changing perceptions.
Exactly.
Okay.
Yeah.
And are there gender differences in drug use?
Yes, there are.
Okay.
Boys tend to use more drugs and use them more often than girls.
Really?
Yeah. And that's probably due to a combination of biological and social factors.
Okay, such as?
Well, there's some evidence that boys might be more susceptible to the rewarding effects of drugs.
Okay.
But also, there are these cultural norms around masculinity and femininity that play a role.
Right. So boys might feel more pressure to experiment with drugs?
They might.
Okay. And what about the harm?
The harm from drugs.
Yeah, what are the risks?
Well, tobacco, alcohol, and marijuana can all have serious consequences for developing adolescents.
Okay, let's start.